Welcome back. Dr. Sidani is here with us in the studios. Welcome to the show.
Thank you.
Now, you're here to talk about a couple things. Now, you're with a group called Healthgrades. Explain what that is.
Well, Healthgrades is actually an independent group. It's a national survey that looks at outcomes for physicians and hospitals. And like I said, it's independent. I'm not part of Healthgrades. They review the physicians in hospitals throughout the country. And they look at the outcomes for different procedures, and it goes through all specialties. And they looked at orthopedics here in Harrison in our results from our clinic, and ended up getting the highest combined scores for different surgeries in the state of Arkansas, and top 10% in the country. So that's,
Now, how long have you been here?
almost 5 years.
5 years?
Okay. Yeah.
And are you the only orthopedic surgeon?
As far as operating at North Arkansas Regional Medical Center, yes. For the last 4.5 years, I've been the only surgeon to perform any orthopedic surgeons at the hospital here in Harrison. There are other surgeons that come into town, but as far as surgery, they're going to have you drive out of town to Fayetteville or even down to Russellville and places like that to do surgery. But yes, I'm the only full-time orthopedic surgeon here in Harrison.
So there's not really any reason for anyone to go anywhere else, because you can provide all kinds of services.
I would like to think that people still do, but yes, and with this Healthgrades now, we have an independent source looking at the outcomes for all the hospitals in the area. We received 5-star ratings across the board for knee, hip replacement, and hip fracture care, which is the 3 orthopedic categories.
Okay.
And we got the highest outcomes for all 3 of the categories, putting us at the highest scores in the whole state.
And
Now, what kind of time frame was that?
It looks at over a 1-year period. Now, we've got the highest scores for hips for the last 4 years, but for all 3 categories for last year.
Wow.
And the Healthgrades is going to be awarding you some...
Yeah, on February 23rd, they're actually coming in and hosting an awards banquet for the hospital and myself. They're going to be presenting an award for us for these outcomes we've had last year.
Awesome.
So you work 7 days a week, 24 hours a day?
Yes, I'm basically if there's an orthopedic injury in Harrison, I'm usually the first one they call. I work most of the times every weekend, almost doing surgery day and night. So
Well, orthopedic surgery has changed over the years. You primarily, I guess, do orthoscopic?
yes, you know, back 20 years ago, arthroscopic surgery came in vogue in the early 80s. Before then, they didn't have anything such as scopes to fix stuff, and so it ended up a much larger incision, longer healing time, that sort of thing. As far as joint replacements go, we've got newer techniques since the mid-90s and stuff where we use smaller incisions, and most people aren't doing that in this area, and that's something we can offer as minimally invasive joint replacement surgery, which basically cuts the incision size by half, cuts the healing time down, and I think that's one of the things that led us to these 5-star ratings for hip and knee replacement.
Now, you're having a free... Did you want to ask anything
Well,
else
I was
other
just
than
going to
that?
ask you, the Orthopedic and Spine Institute, located where?
It's at North Arkansas Regional Medical Center, and if you've driven by the hospital, you can notice the new tower. It's brand new, just opened a couple of years ago. When they were building the tower, I picked a certain block of rooms for orthopedic patients. It's easy access in and out from the hospital. We have designated parking spots right outside the hospital for our joint replacement patients. And those rooms are basically just for orthopedic joint replacement. So you haven't had people in there with infections and that sort of thing. And that's something we keep a close eye on. And so it's basically the Orthopedic and Spine Institute is a special section of the hospital. We have specially trained nurses. It's easy access in and out, and private rooms, of course, and in the new part of the hospital. And so it's sort of a team concept as far as specially trained nurses, anesthesia, a physical therapist, that sort of thing.
Okay.
Go ahead.
Well, you've got something coming up in Mountain Home, the free lunch and learn. Why don't you talk a little bit about that?
Yeah, we give. I give lectures probably every few months, and we've done several in Harrison. We've done lectures in Jasper, Berryville, and Marshall, and our latest one is going to be in Mountain Home on February 9th at 11:30 to 1:30 at the El Chico restaurant. We're going to have lunch provided. And basically, I just give a lecture about what it means to have a joint replacement, what osteoarthritis is, what it is. A lot of people say, go to their doctor or physician. They were told they need a joint replacement. It's kind of a scary thing, and they hear all these stories from an aunt or a relative and all these horror stories. But really, it's just to kind of educate the public, let them know a little bit more about joint replacement. It's not such a scary thing that can really improve your quality of life. And our biggest or most popular part of the presentation is just a question and answer, where people have several questions that they weren't able to get to their doctor and answer, or their doctor didn't spend enough time with them in the exam room, and they didn't get a chance to ask some of these things. So it's a kind of an informal deal where you can ask some questions, get a little lunch, and get a little presentation.
And certainly education will help alleviate a lot of fear.
Yeah, and that's where it starts as far as treatment goes. If you look at the whole program of joint replacement, really it starts with patient education, and that's what we focus on.
I suppose too, this isn't necessarily, I mean, if you're having a joint replacement, going to be having one, then certainly this would appeal to you, but also if you're just interested in information.
We have several options for non-operative treatment for osteoarthritis, whether it just be lifestyle changes like diet, exercise, stretching, physical therapy, medicines, and injections. So we talk about several other things rather than just surgery. So,
so if someone's interested in coming, do they need to call ahead? And
there are limited spots, so you may want to call ahead. They fill up pretty quickly.
At your office or what? Oh, okay. Joy Wahlberg at the hospital.
Yeah, there is an RSVP process, so it is something you probably need to call ahead.
It's called Harrison Hospital, North Arkansas Regional Medical Center.
Yeah.
Okay. Yeah. All right. We thank you for coming
Thank
by,
you.
and I know you got to run
thanks for having me.
You've got patients to look at today.
Well, thanks for having me, Bob.
And we'll have you back sometime again, maybe, and talk a little more.
Okay.
Thank you, sir.
Appreciate it.
Thank you.
We're going to take a quick break, and when we come back, we'll be talking with Matt Bell, talking about an adult basketball league. A bunch of old guys out there trying to be young again, looks like. We'll talk to him about that in just a few minutes.
Don't get injured or you'll go see him.
Yeah.